Hey guys, what's up? It's your girl Kay, and I am back with a new video. My ridiculously big shirt. It looks cute in a total outfit, but right now it just looks like I can't fit my clothes. So hey, what's up guys? How you guys doing? If you don't know me, my name's Kay. I am 29 years old. I go to a local community college for nursing, and I am in my second semester. So, I had to stretch. I've been studying all day. I have an exam on Monday, and it's about a varying amount of topics. So I've been trying to study all weekend. It's not that easy when you have to work every day. So I've been trying to get a lot of stuff done, and I decided to take a break to make a video for you guys because I haven't made one since I think before school started. So here I am. Let's get down to it. I got a couple of questions from people who are asking me the difference between a 2-year school and a 4-year school. And I'm not really quite positive exactly the differences between those two, but I know that it's 4-year school is more theory based. You learn about more about theories, nursing theories and like nursing process and things like that, and then you start moving on to hands-on work. I have a friend who goes to a community college at a really not a community college. I'm sorry, I can't. She goes to a really good college for nursing, and she is in her junior year and she's just now learning how to do vitals. Whereas my first semester, I learned vitals. So I think because it's a 2-year school, you learn a lot faster than with more hands-on things in the skills than you do at a 4-year. I think a 4-year, the beginning is more like learning theories and stuff and like the knowledge, and then you move on to actually perfecting your skills. So I think that's the difference. I could be wrong. I'm not a genius. I'm not a teacher. I don't know. If I am wrong, comment below and let me know, what the difference really is. So trying not to make a huge long video for you guys because it's late and I'm tired and I want to lay down. And as you can see, my room is disgusting because I don't have time to clean. I literally do not have time to clean. Between 4 days of class, and 3 jobs, I don't really spend a lot of time in my room, and when I do, it's under the sheets. There's crap all over the bed, but this is my side right here. My girlfriend's in the hospital again. We are getting very close to planning stuff for our wedding. I think it's going to be pretty awesome because we're really trying to like get on top of things, and it's not going to be super expensive, and that's all I'm looking for is not spending any more money because I don't have any. So yeah. And we're also doing our TTC journey, but that's a video for other people who want to pay attention to that. This is nursing. Hi, nursing. So my second semester, this is what I've learned so far. We're in our 3rd week. As for skills, I've learned sterile technique. I've learned how to, put on sterile gloves, prepare a sterile field, for cleaning wounds and things like that. And it's been a real experience because you have to do things a specific way, because if you contaminate those sterile items, you have to start all over again. Contaminating items, especially for surgery or after surgery or whatever, when there's open wounds or wounds that can get infected and you're not using sterile items, you can kill somebody, and that's a big deal. So we learned that. Just the other day we learned IVs. We learned how to hang IVs. We learned how to prepare them, spike them, prime them, set drip rates without a pump. And that's a hard thing, but it's not too hard, but it's a tedious thing, but without pumps. And most hospitals use pumps now. But we learn a lot of things like old school because sometimes technology is not going to be there. So that was pretty interesting to learn the math and everything. Actually learning what you learned in drug calculations and putting it to use is pretty cool. So we've done that. We've learned in lecture classes, we've learned about diabetes. We've learned about shock. We've learned about pneumonia because if I didn't explain this already, this semester we're learning psychology and med-surg. And pneumonia is a very big risk for post-surgery because patients are not moving, they're not coughing, they're not getting, all that stuff out of their chest, and they're just sitting there and they're laying dormant and they need to be able to breathe. So it's a very high risk to get pneumonia after surgery because you're not mobile, you're not getting all that stuff out of your chest. So we learned about pneumonia. And we learned about operatives. So before surgery, after surgery, during surgery, nurse nurse interventions, management, assessments, things like that, what we're supposed to do during each stage of the process. And we learned a little bit about meds. As for psychology, we've learned about ethical process, the nursing process in psychology, not too much into the nitty gritty. I, for clinical, am doing med surg, whereas the other half of my class is doing psychology, and they're working in psych hospitals. I'm working in a regular hospital on the med surg unit. I can't discuss too much about my patients because that's a HIPAA violation, and I don't want to get fined or arrested and kicked out of school. But I have done a couple of cool things. I've given insulin, which was awesome. I've passed out some meds. I've given eye drops for glaucoma. I found these really cool machines that they use in the hospitals now called Iceman. And it's basically like a machine that runs water through a compress that they put around, your leg or extremity that you had surgery on. It keeps the swelling down, and you fill it with ice water, and it runs through all the time, and you just keep refilling it with ice. And I didn't know we don't have those. My hospital doesn't have those, so I thought that was pretty cool. I've given out oxygen. I learned how to do that, which is not as hard as they make it look. I've had some really cool patients. My patients have been really friendly and really patient with us. We've done some glucose monitoring and things like that. So, a lot of stuff that we've been doing have been documentation as well, going into the computer system and documenting everything that you've done. So we have like a set thing that we do. I kind of have a set way that I like to do things during clinical, and I think that that's one of the huge things about becoming a nurse, being able to get into a routine so that you can do things efficiently, especially when you have 4 or 5 patients you have to work with. I only have 1 patient, so it's easy for me to do it. But when you come in for your shift, I like to go into the room, introduce myself. Hey, I'm Kirsten. I'm going to be your student nurse today. Do vitals, temperature, blood pressure, O2 stat, things like that. What's your pain level on a scale of 1 to 10? Do you need anything before I go? I'm just going to go do some things, and then I'll be back to check on you after dinner. You go back and check on their chart and their orders, see what kind of meds they're supposed to get throughout the day, so that you can kind of make like a mental list or even write it down, what you're supposed to give them at what time, so you know when to go back into their room and you're not just sitting around. And by then, it's time for me to have my dinner because it's late. When I come back from dinner, I go right into their room. Hey, what's going on? Do you need anything from me? Can I, refill your Iceman? Do you need some water? Whatever. I'll be back at 7 o'clock to do your vitals. I'll be back at 8 o'clock to give your meds. I'll be back at 9:30 to, give you your other meds. I need to check your blood sugar, things like that. So it's kind of like a routine, and you kind of get into it. And also a cool part about my clinical experience is that each week one of us gets to go into the OR. And so, of course, I get the last week, but that's fine. So I'm looking forward to being able to see an actual surgery. But for the most part, that's pretty much what we've been doing. It's been a really busy couple of weeks, and it's only the 3rd week, so I know that I'm just going to be swamped. It's been really hard, working and stuff like that. I have lecture 2 days a week, as well as a lab one of those days, and then clinical 2 days in a row. But I think that it's kind of cool to have clinical 2 days in a row, because instead of once a week, because patients get discharged so quickly that at least if you come 2 days in a row, you're able to see that patient, see the progress or the deterioration. I actually saw the formation of fracture blisters on a patient, which was really cool, because the day before, the patient had like a little tiny blister, and you thought it was just maybe because of the bandage was rubbing against their skin. And then the next day you come in, and these big red, like huge blisters up and down the patient's leg, and it just formed overnight, and it was crazy. But it's something that you don't get to see if you only see the patient once a week. So I'm kind of glad that we have that experience. So I think that's pretty much all I want to tell you guys. My video's catching up to 10 minutes, and I don't want to be sitting here too long. But if you have any questions, make sure to hit me up in the comments, or send me a message, or a response video, or whatever. Thanks you guys so much for watching my videos, because I know that you don't have to care, and you do. And I want you to check out Nurse Mendoza. He's a male nurse. He's awesome. I watch all his videos all the time. this is the reason why I wanted to start making videos in the first place. As well as another YouTuber, Adam Deshawn. He's awesome. He's an LPN. I started making videos because I started watching his videos as well. But, you know, check out their videos, especially Nurse Mendoza, because he has a lot of different topics and he'll definitely help you out, because I watch his videos even now and I learn a lot of things. I talk with my hands. I'm sorry. I'm going to go lay down now because I'm tired. Probably clean my room tomorrow, but I have to get to studying because I got a lot to study. So, have a great night, you guys, or a day, or whenever you're watching this video. Continue on your journey with nursing. I will give you guys a new update video very soon. Probably when I switch into my psych rotation. But yeah, have a good night, guys. Well, good day. You guys know, I'm tired. I'll catch you guys later.